The Centers for Disease Control and Prevention, or CDC, has confirmed the first severe case of H5N1 bird flu in the United States this year. This concerning development marks a shift from the milder cases reported earlier in 2024. The patient, residing in Louisiana, is currently hospitalized. This case raises concerns about the potential spread and severity of this virus. This is the first time a U.S. patient has experienced severe illness from this particular strain of bird flu. Health officials are closely monitoring the situation. They are working diligently to trace the source of the infection and prevent further spread. H5N1, commonly known as bird flu, is a type of influenza virus that primarily affects birds. However, it can sometimes spread to humans, usually through close contact with infected birds or their droppings. While human infections are relatively rare, they can be severe. Earlier this year, the US saw 58 mild cases of H5N1. Most of these cases were linked to exposure to poultry or infected dairy cows. Symptoms in these cases were generally mild, including conjunctivitis or pink eye and respiratory issues. All individuals made a full recovery. The Louisiana case marks a departure from the previous mild cases. The patient, whose identity remains confidential, had exposure to sick and dead birds in backyard flocks. This detail is significant, as it's the first U.S. case linked to such exposure. The investigation into the source of the infection is ongoing. Health officials are working to determine if the virus originated from a specific flock or if there are other potential sources. The patient's current condition is unknown. Despite this concerning case, the CDC maintains that the immediate risk to the general public remains low. However, the agency emphasizes that individuals who work with or are frequently exposed to birds are at a higher risk. This includes backyard flock owners, poultry workers, and hunters. The CDC is conducting genomic sequencing of the virus to understand its genetic makeup and identify any concerning mutations. So far, there is no evidence of human-to-human transmission. This means the virus is not currently spreading from person to person. The CDC continues to monitor the situation closely and provide updates as needed. For now, the focus remains on preventing further spread and protecting those most at risk.